So Gladys, you're here today, 13 weeks after your bunion and hammertoe operation, right?
Yes, ma'am.
So how do you feel?
Feels good.
It feels good? Are you in a lot of pain?
No,
Were you in a lot of pain before the surgery?
a good bit. Yes, ma'am.
Okay, like how much pain did you have?
Well, I'm not sure as far as you couldn't wear your shoes.
Like you had a
Yeah.
bone that was sticking out, right?
It pressed on your shoe, so you had to go to a real wide shoe. And then you still had the hump on your
Right,
shoe where
right,
the
like a
toe
bump
was
on the
pressing.
side, right? And then
Yeah.
your toe was also sticking up, right? So it was
Yeah.
giving you a lot of, like you couldn't wear shoes.
Right, I had the hammertoe and the bunion.
And the bunion surgery. So you're about 3 months out now, right?
Yeah, you did it in October.
October.
Last of October.
So and it's beginning of February. So yeah, you're 13 weeks out. We just looked it up.
Yeah.
So basically, was it a very painful operation?
No, not real. I mean, it's your foot, so you're on it to where it's worse, I guess, than it would be if it was something that you didn't put a lot of pressure on.
Right.
I got along really good.
Did you take pain medications?
I couldn't take what you prescribed because
of nausea?
I was allergic to that.
Allergic to it.
So I ended up just taking Advil.
So you didn't even take any prescription? Wow.
No. So I did really good.
And then you had a pin put in, right? And then I pulled it out, 4 weeks after the surgery?
I had a pin, I'm not sure. It was in there. It seemed like
forever.
It seemed like a long
time. It was 4 weeks.
But
and you had to wear a boot for 4 weeks, right?
Until the pin came out.
Right. But you were able to walk right out of the operating room.
Yeah.
So for people who live with this and they have, discomfort and they have this bump and they can't wear any shoes, I mean, would you recommend this surgery?
Oh, yes, definitely.
So it was not like this ordeal it was pretty easygoing, and I mean, it's foot surgery, so
it's surgery, of course you got pain.
Of course.
But when all's said and done and everything gets back to the swelling, the swelling mainly is what's bothered me, I think, more than anything, because you have to continue to wear a bigger shoe for a while.
Of course, of course.
But as far as the pain part, there's no pain. It's just me, wanting to put on a different shoe.
Right. I mean, it's long term, right? I mean, of course, you're like, okay, I just had surgery and now I have this swelling and I still have to wear a bigger shoe.
Yeah.
But women, we swell much more than men do. So I think it's kind of almost assumed that for 3-4 months you're going to have the swelling. And we stand on our feet and we use our feet a lot. So I mean, as long
weighing everything, and I'd still do it.
Oh, good.
Yeah.
Good. Well, thank you so much for sharing it with us. Thank you.
Thank you.